So umbilical cord use by myself, assistant clinical manager for special care nursery and pediatrics. First off, the umbilical cord is an underutilized resource in early neonatal care. The umbilical cord can be used for intrauterine drug exposure testing. The umbilical cord blood can also be used for admission labs, which we have a lot of those. The umbilical cord is sent to the lab for drug testing for infants that meet the following criteria. Mother received no prenatal care, placental abruption, admitted use to illicit drugs during pregnancy, positive drug screen prenatally, and just at a physician request. The umbilical cord is easier to collect versus meconium. It's easier because you can get it right after birth versus the meconium. It takes time for an infant to pass meconium, and then you have to make sure that you have an appropriate amount of meconium. And sometimes if they have a big blowout, it can take forever. And sometimes we may not even be able to collect enough meconium to send. Also, the umbilical cord is more sensitive to testing versus meconium. The umbilical cord gives us results for more than meconium does. Only 6 inches of the cord is needed. It's about the size of an adult hand. The cord is cleaned, dried, and sent to lab for processing. The umbilical cord results are reported in about 4 days, and the cost of processing is only a few dollars difference, which is huge for our patients. Umbilical cord is for labs. So many of the infants with suspected sepsis and chorio have negative blood cultures. I think since, the time that I've been here, we've maybe had a couple of kids with actual positive blood cultures for chorio, and some of those come back actually as contaminants. So really, we don't have a lot of kids that actually test positive for chorio. So despite the infants having negative cultures, they are being taken from their moms right after delivery to have these labs drawn. And here we like to promote breastfeeding. We want to do skin to skin. We want the